Welcome back to Daytime with Kimberly and Esteban. I'm Carla Salinas, and today we're at JNC Behavioral Services in Edinburgh to speak to Dr. Francisco Torres all about the early signs of dementia and what they can do to help. JNC Behavioral Services provides quality treatments for depression, anxiety, and even dementia.
Dementia is a neurological disorder that consists of having problems with memory. That is also associated with progressive difficulty on executing certain daily activities.
Dr. Torres explains, although dementia affects mostly older adults, it is not a normal part of aging.
Normally, we start to screen intensively for dementia after age 60 or 65. The patients normally, we start to do memory tests for them, and we screen, and it gives us a certain score. And according to that score, we start to make some placements. And if any of those screenings turn out to be positive, then we have to do further testing with blood work. Sometimes it will require brain imaging.
And although Alzheimer's disease is the most common type of dementia, there are several other types of dementia.
The fact that we have memory glitches doesn't mean that we are heading toward dementia. After age 50, we're going to start to experience some decline in our ability with our memory and processing information, but that could be expected with normal aging.
Dr. Torres explains it's important to keep in mind that dementia isn't as simple as forgetting to get something from the grocery store.
The problem is more learning new information. So that is a very important key. So we start to feel that our loved ones are struggling with memory problems. They're doing more mistakes at home, leaving the stove on and forgetting about it, or they're ironing a piece of cloth or something and they just leave it on and they start to burn their clothing or things of that nature, those type of mistakes. That is telling us that we are starting to have something more serious than just getting forgetful.
Although dementia is a chronic disease, there are several ways that JNC Behavioral Services can help.
Also, we try to work on the behavioral component, either by having an occupational therapist or doing some specific type of psychotherapy to help them to cope better with the situation. Now, part of the treatment is for the patient, but sometimes we also have to keep in mind that the person that is caring for this person needs some kind of counseling.
For more information, call JNC Behavioral Services at 956-600-7807 or visit www.drtorres.com.